What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host Keoni Tita. Keoni, how are you today?
Good. Hey, everybody. Thanks for being with us once again. I'm excited about this one, as I am always with these podcasts. This one is something I get a lot of questions about. Basically, what do cracking joints and the noise we hear in our joints actually mean? So
Yeah,
I'm
absolutely.
I'm thrilled to have you educate us, Brian, because I think I can learn a lot from this one myself.
Well, before we get started, Keoni, we got to give a shout out to the new people. You're always shouting out the old people. We got to get the new people coming in as well. So if
Yeah,
you
yeah,
know someone, let them know about the podcast. If they
yeah.
may kind of a health issue or something that you know about that they would be interested in, certainly send them an episode. Like the artificial sweeteners one that's going to come out right before this would be beneficial for everyone just to better understand what those little packets have in them.
Yeah, yeah. If you guys find this information helpful, please spread the word. I mean, it would be helpful for us. And Brian and I, we don't make any money off this. Just about educating ourselves and anybody else who's willing to listen to us.
Yeah, absolutely. But okay, Keoni, like you said, it's about why our joints are popping. And what I wanted to do is kind of explain what could possibly be happening and allow or kind of let you guys peek behind the curtain and how my brain works as a doctor of physical therapy on what this popping may mean and if we need to address it and to what degree do we need to address it. So I know it's something that is a lot of people ask all about, and there's all different types of sounds that come from our joints, Keoni, right? I remember going to Wake Forest's strength and conditioning camp one summer, actually. And my friend right beside me, we were best buddies as kids. He kept squatting. Every time he would squat, his knees would pop.
Yeah, you'd hear it. And I've had that same thing happen to me a number of times.
Right. Now, was it painful, Keoni, when it happened to you?
No, typically it wasn't. Typically it wasn't painful. It just, it's just a little nerve wracking because, if you don't know any better, you think you're injuring yourself.
Absolutely. So I'm hoping with this episode to kind of quell that nerve wrackingness by kind of better understanding what may be going on. And the first way to understand that is exactly what I just asked you, Keoni. Is it painful? So we can have lots of different popping, lots of different structures moving over different structures that could cause an audible sound. The biggest thing I want you guys to take away from this is if it's painful, it definitely needs further investigation. If it's not painful, it's likely not really a problem. And we'll find out a little bit more about why that is. But first and foremost, painful, let's go seek help or seek further investigation. Not painful, it's likely just fine.
All right. Well, that's good to know because I get that question a lot.
Yeah, so that's the first kind of category that we work through in our brain, right? The first initial foundational question we ask ourselves about this sound coming from our joints is it painful? Yes. All right, let's check it out. No, it is probably okay. Now, as
Okay.
far as what that sound could be, Keoni, I made personally kind of how I categorize sound, like the sounds that may come from our joints specifically into two ways. And one of those is basically your fingers popping. So that little sound when you snap your finger or
Yeah.
pull your finger apart or maybe move your shoulder or your hip, or like we were talking about in the hip health episode, Keoni, sometimes I wake up in the morning, roll to sit up and let my hip kind of internally rotate. And I get this loud, big thud, kind of my
Yeah.
hip going into its range of motion and freeing up. That is called tribonucleation, which is a physics term. It's a big word for basically when opposing surfaces resist separation until a critical point where they separate rapidly and create a sustained gas cavity. And we got to remember that the joint is in a bag, right? The joint is in a nice confined joint capsule in space, and there's fluid in that space. And so when we begin to pull our finger apart from our joint, you are slowly increasing the pressure in that little space, right? In that joint capsule. And the process of that pop is tribonucleation. And they actually saw this directly on an MRI in 2015. This guy, Kalchuk, and some other researchers did a study using an MRI, put people's hands or within the MRI machine and performed kind of that long axis distraction, which is me pulling my finger straight from the joint to get that pop that I just did. And they saw on the MRI the actual formation of that gas bubble with the audible sound. So
wow, that's amazing. Where's that gas bubble coming from? I mean,
so it's coming from basically the synovial fluid undergoing a phase change from fluid to gas through this level of pressure.
That's fascinating. Okay.
So it's super physics related.
Yeah, absolutely.
And what they saw in 2015, again, this is Kawchuk, K-A-W, Chuk, C-H-U-K. And they did real-time MRI, and they demonstrated rapid cavity inception at the joint at the time of separation and sound production, after which the resulting cavity remained visible, which is interesting because we used to think, Keoni, that pop was actually a gas bubble popping, like kind of like a.
That's what I always heard. You're right.
Yeah, bubble wrap. They demonstrated in that study specifically, it's the exact opposite. It's actually that bubble forming. Now, eventually, just moving and through time and less pressure, that bubble is going to dissipate. And again, we're just going through a phase change, right? So it's not like all of a sudden something is created out of thin air. We're basically making a liquid, a gas, and that is the bubble. And eventually that bubble is going to return to the liquid state.
Okay.
So that is primarily the first way I think about popping that's not painful, is that cavitation or that tribonucleation. And more often than not, this is probably what's going on with you. That example of me waking, if it's not painful, that example of me waking up, kind of rolling over and letting my hip internally rotate and getting that loud thud, that is my femur trying to pull from the acetabulum, because we talked about accessory motion, which means the joint motions, the arthrokinematics, how the bones are moving on the bones. All that is where this pressure is coming from. And that's how I get that loud thud when I turn over and roll over and my hip pops.
Okay, so let me get this straight. So you're saying that from you get this thud because when you're talking about your finger joint, you're pulling them, you're creating a low pressure zone or something? That's a
great question. I don't want to speak incorrectly on if it's low pressure. Yeah, it's a low pressure zone. It's similar to, Keoni, when you unscrew like a Coke or a soda and all the gas starts to fizz at the top. It's very similar to kind of why that
so it's
happens.
Not high pressure, it's a low pressure zone, which makes sense. I mean, you're pulling the joint apart, but okay.
So the pressure,
I'm confused on it, but that makes more sense to me then. So it's similar to like a soda. That's a good analogy
of just how that phase change is going to go, right? Because in the soda, we don't all of a sudden, when the gas bubbles form, they don't form out of thin air. They were in theory already there. This change in pressure causes this phase change to experience the bubbles.
Yeah, I got you.
And we are having, whether it's low or high, I'm not entirely sure. I believe it's low, but whether it's low or high, we're having some sort of change in pressure that's resulting in this phase change of our synovial fluid. And we're getting that gas bubble. And that gas bubble, the sound of it is it being created.
Got it.
And there's a few different kind of benefits to that, or why it feels good. Like when people see a chiropractor or they pop their back and all of a sudden it feels really, really good. So there's 4 different kind of categories of why that may feel good. And those 4 are, there's like a psychological component. There's definitely a mechanical component, a neurophysiological component, and then possibly a chemical component. So if we're thinking about like what could be the psychological component of that, let's say I'm performing a mobilization or a manipulation on someone and I pop their back. I'm touching them. I'm also, which has in theory some, we know touch can heal, or the healing touch.
Absolutely, yeah.
And then we also know about kind of induced movement. When we move through a range that necessarily and I see this a lot, like after an ACL tear, Keoni, where someone's afraid to reach that full extension of their tibia, and you do it for them and almost kind of show the body that this is okay and it's not going to hurt. And that can kind of assist in this psychological belief that we feel better and we can now move through this range of motion. And then also people have different reactions to the pop. As a physical therapist, I would say doing that type of mobilization or trying to manipulate someone's back, the pop isn't necessarily necessary, but people certainly have like a emotional response to the pop possibly.
So what you're saying is the pop is placebo.
Yeah, the actual pop is someone just getting a placebo effect. We know what it's
Why
from.
haven't these chiropractors told me this?
Well, and so they're not wrong. It's not all placebo, but we definitely in the
right.
psychological component, that effect of the pop, even just thinking that this pop allowed us to move more, may have that positive placebo effect that we know.
Yeah. And hey, let's not talk bad about placebo, because that's also a good thing. Right.
One of our most powerful tools.
Right.
And then mechanical is another possible reason why these pops feel good, right? And I'm talking specifically right now about like those finger pops. When you crack your knuckles, you bend and crack your back and you feel stiff and then you feel relief. So we talked about the psychological components. There's also the mechanical components, which it is truly stretching and kind of restoring and elongating the fibers of that joint capsule. So you're getting some movement and stretching of the tissue that's in there. And that is a positive thing and may allow us to move more. And that's the primary reason why we do like a mobilization like that, like to someone's thoracic spine, which is often where people feel super tight, right?
Right.
And so we definitely can get that stretch within the capsule. There's people, and it's debatable in physical therapy. I know some people who've said they've totally done it, and I know some people don't believe it at all, but you can certainly get this if you have like a surgery where you could snap an adhesion. So like if you have, let's say it is an ACL surgery and they did a not so great job, there's a lot of scar tissue around there. It's a possibility that scar tissue could build up within the joint and limit your ability to move. And that would be kind of that adhesion. And sometimes, and I have heard anecdotally, some therapists perform a mobilization, snap an adhesion, and now all of a sudden our arm is free range of motion, that whatever it was limited in. Okay. Debatable, but I've also, I've had my friends specifically who I trust, who are physical therapists, tell me that they felt it.
Right.
So
and adhesions aren't debatable. I mean, you do get scarring. You can get scarring from surgery and stuff like that. And,
absolutely.
Big complication of certain surgeries.
The ability to pop them within physical therapy while someone's waking and it's their shoulder is the debatable part, but you're exactly right. And then the neurophysiological effects. I really want to focus on two here. There's all types of theories of pain, right? But again, this is the effects of that passive movement and possibly like a manipulation and a pop. So we know there's a variety of pain theories. I'm going to kind of skip those, but there is the theory that we are assisting those various pain receptors in different ways and kind of interacting on them in various ways. There's also for sure, and this is where your chiropractor friends definitely know about this, there's muscle inhibition by these mechanoreceptors. So mechanoreceptors are little signals in your joint capsule. For this purpose, we're talking about your joint capsule, and they sense. Basically, when you have that pop, you create that gas bubble, you stimulate these type 3 mechanoreceptors, which are inhibitive. So they give you this relaxation feel. That's why when you get an adjustment by the chiropractor and you walk out feeling like you could just relax on a beach and fall asleep.
Right. I certainly have. Yeah. Okay. And so you're getting a release of...
You're activating these type 3 mechanoreceptors, which are inhibitive for your muscles. They tell your muscles not to fire and to relax. So you get this relaxed feeling throughout your whole body.
Okay. That's very interesting. Right. So so there's like a burst of relaxation energy, if you will.
Yeah. I mean, you're stimulating those receptors, and that gas bubble kind of distends the joint and tells you to relax. It's almost like kind of when we see a lot of swelling in the knee, Keoni, the first thing that shuts down is that vastus medialis muscle, the teardrop muscle, because the swelling inhibits the ability for that muscle to contract really well. And you're at a very, very lower level, somewhat doing that with these type 3 mechanoreceptors when you create that gas bubble.
That's cool. Okay.
So the sound is not something to be super afraid of at this case, right?
Right.
And then
it sounds like you want it almost.
Yeah, almost. And again, the sound doesn't necessarily mean anything happened other than that phase change. It's possibility in that debate we were having that maybe you snapped an adhesion, but for the sake of kind of what we've seen and the typical, you crack your knuckles, that's that gas bubble.
Okay.
And just while we're here, Keoni, often I get asked if like cracking your knuckles is going to cause arthritis or degrade your joint integrity.
Yeah, that's a big myth I've heard over and over again. What's that all about?
So is it a myth? Yes, but there is a caveat to it. It's a myth in that in cracking your joints, creating this gas bubble is not going to result in some sort of arthritis or immediate arthritis or any long-term changes based off just cracking the joint. But and we talked about part of the reason we crack joints within physical therapy or a chiropractor possibly is to get more motion at a specific joint or a specific segment. Like if we talk about thoracic spine, I want you to be able to bend more in your thoracic spine so your lower back isn't as demanded upon. And so with that, if you're super unstable within that new range of motion we just created, and you're moving in a very uncoordinated fashion, you can certainly have those joints bumping up against structures or moving along structures in a way that they're not necessarily intended to, or in a way that they can't control adequately to ensure we're not getting, kind of like degenerative joint disease where we get that long-term, or like an osteoarthritis would be more appropriate, where we get that kind of compressive, long-term kind of breakdown of the joint integrity. If you're not able to control the motion that we just created from this pop or these mobilizations, then you could possibly set yourself up for something like osteoarthritis or some type of joint changes because you're not moving through the joint well and controlled.
Okay. And
Does that make sense?
Yeah, it makes sense to me. It's like basically, if you don't have good posture, right, over time, you can cause problems. Goes for this. I imagine the same thing when you look at an isolated joint space. I mean, if you're not moving appropriately, you're going to create problems.
Yeah. In short, absolutely.
Joint. Yeah.
Yeah. 100%. So that was cavitation, tribonucleation, and for our purposes, because we don't like long, big words, except for Keoni and all his foreign European word, is tribonucleation is that pop of like my finger or that pop of my hip just in day-to-day life, right? Or it may be through some sort of traction force. But that's that first kind of component of how I'm going about talking about these different sounds that can possibly come through us. But again, these two categories I'm talking about are when it's not painful, right? So if it's painful, that's a sign. If we have a pop and pain, that's a sign for further investigation.
Right. And if we don't have pain, we're good, right? For the most part. I mean,
most likely.
Yeah. Okay.
Yep. Most likely. And then, so the other category of why do our joints make sound is a structure moving over another structure. And we can get this in a variety of ways. So we know, and we call it crepitus in physical therapy, and which is kind of that creaky sound. If you've ever heard anyone kind of bend their knees, or I had a patient recently,
cracking and crunching sound
with movements. Like I've had a patient who laid on her back, and then if she would swing her hips over and her legs over, and she got that spinal twist, there'd just be creaking, cracking all up and down her spine. But it's a little bit different than that kind of tribonucleation pop that I was talking about before, because that tribonucleation pop is likely only going to happen once. So one way to kind of discern, or, within a few minutes, for example, like if you do 20 of them, you're not going to constantly get that pop. Whereas with this crepitus type situation or a structure moving over another structure, you're going to discern this by most likely having that pop or sound continue throughout. So you're doing 20 reps, 20 of those swinging your hips back and forth while you're laying on your back, doing a spinal twist. It's likely going to stay with you and not necessarily decrease with each rep. Whereas the first type, that tribonucleation, would.
Okay.
So we know, as people notice, when you get older, we do hear some things from our joints, and it is a total normal part of the aging process. And as surfaces get rougher and rubbed together, we get kind of this breakdown of joint integrity, and we can hear some of those joints moving over each other, and those arthrokinematics, or that accessory motion that I'm always talking about. And very often, and there was a study done on this by McCoy, and this was actually in 1987, but they looked at people with patellofemoral crepitus. So every time they flexed or extended their knee right at the patella, they would get some sort of cracking sound, crunchy, cracky sound. 99% of them were completely pain-free. So again, just reiterating that we're talking once, the first foundational question is, was that pop or sound painful? And if it was, we need to further investigate it. If it wasn't, most likely we're fine. And
if it wasn't, whether it's tribonucleation, cavitation, or this crepitus.
Which this crepitus can be, and again, I threw it under the category of structure over another structure. So crepitus is when the structure is some arthritic type changes, or that structure like the joint is moving over and we hear that. There's also people, you may have heard of this, Keoni, snapping hip syndrome. So when someone like flexes their leg or lifts their hip up while they're laying on their back, they get a pop.
I've seen patients with that.
Yeah. So that is another example under my umbrella here of structure over another structure. That what we're hearing is some sort of anatomy moving over another piece of anatomy, and not necessarily like the joint. Like it may be, for example, this is one of the most common reasons for that snapping hip syndrome is the IT band snapping over the greater trochanter or the femur. So that greater trochanter is where a bunch of muscles attach. And basically we've got a long piece of connective tissue that's almost like strummed like a guitar kind of over that greater trochanter. And that's what may be causing some of that sound.
And it's caused by, it's a structural thing, maybe swelling there, or?
It would be a structural thing. Yep. It can often be addressed if you rotate your legs out because you're just changing the anatomy and the angle of everything. And there's a bunch of different things that fit under snapping hip, right? So it can be external, it can be within the hip, or it could be some of those crepitus type changes, some of those internal in the joint changes, intra-articular changes within the joint. And we also know there's another possibility for that snapping hip syndrome is that the iliopsoas tendon, which would be over a bony prominence in the pelvis that we would hear it snap over. And you would kind of be able to feel the difference. One of these would be on the outside, one of these would be on the inside. But my point is this happens in the shoulder too. We may get some sound from a structure sliding, gliding, or just moving over another structure, particularly when we're thinking about like the hips and our shoulders, where we have a lot of kind of like bony prominences.
Okay.
So those are our two categories. We've got structure moving over another structure, and then we have the cavitation tribonucleation. That structure moving over another structure and that cavitation over tribonucleation are both not painful. And if it is painful, we want to check it out. And most of the time, these changes or these things are completely harmless, more or less. Obviously, some arthritic changes are no good, but this is much more likely than like our tribonucleation to be something that occurs when we see an elderly or more aged person move.
But you make it sound like that with the crepitus situation, that it's like once it's there for good, right? But I sometimes it comes and goes for people.
Yeah, absolutely. So then that's where we get to motion is lotion, right? We can restore some of that joint integrity by doing that repetitive compression, decompression that we're always talking about to help bring nutrition to the joint. And certainly, like we talked about in our regenerative medicine episode, some of those things come into the forefront, can certainly play a role there. But if even just, and so when I saw the patient who was primarily seeing me because she was having a lot of crepitus in her spine, the more we got her back mobile and the more we got it coordinated, and then I continually worked on distracting her spine, so creating more space within the joint, she had a little less popping as we completed our plan of care. Now, it wasn't a lot because we're not going to make huge, we're not going to start a brand new knee, but we can certainly improve the situation.
Right. Yeah. I mean, I know myself, I've had some of that cracking in my knee, and it does seem like the more you move it, the better it gets, to where I don't even notice it anymore.
Right. And you may have gotten stronger for all you know as well then at that time, or maybe it was a weak specific muscle that was leading to poor motion, which could have led to some of that, like we were talking about, where if you do crack too much and then you can't control that motion, you create those long-term joint changes. This is how your cavitation is leading you to crepitus if you're not controlling it.
Okay.
So those are the two ways that I really wanted to go about thinking about what are the non-painful sounds. So we know if it's painful, we want to check it out. If it's not painful, there are a variety of things that may be happening, but the big point is most of them are not to be too concerned about.
Great.
So that was how I kind of broke down myself how sounds play a role, and I explain kind of the sounds we hear from our joints to patients. There's a website, Physiopedia, Keoni. It's a great resource for physical therapists and a variety of like health information if you want to go there and learn about whatever musculoskeletal condition you're concerned with. It's a great resource to do that. And I went there to kind of find out what they thought about all these sounds. And they had a page on the knee, and they described popping, clicking, clunking, creaking, cracking, snapping, fine, gritty, or grating sound. So you can see we have lots of different possible sounds. We got a symphony of joint sounds here.
And so I'm sure they all mean something different, right?
Exactly. But you can see how what I was trying to do is, hey, is it painful? Yes or no? And that's our first and primary concern.
Right.
And then from there, was it through movement? Did it go away after one time, kind of like we would if we pop our fingers, or is it kind of continually there with that crepitus? This one gives you a little bit more possible acute sounds and further differentiates the types of sounds. So they said a pop is heard during a trauma or some sort of injury. I commonly hear this if someone tears.
I do too. Yeah, I do too. I hear this if somebody, hurts their ACL. Mostly it's their knee, but it's hear about it in their hip or if they. Or in their back. I heard somebody say that they heard a pop doing leg press once in their back.
And it's funny when I think about kind of that sound of cracking my fingers. I wouldn't necessarily describe it as a pop, but I'm not sure as far as it goes into this category. But a pop, that loud pop where you can you're cued into possibly an actual tear. It really feels that way or sounds.
And it's it's probably going to be one time you hear it, right?
Like, that's a great point. Yeah, absolutely. That's a great point. You're certainly not going to move the ACL after it's been popped and hear it speak to you, other than yelling at you. And then there's clicking. They mentioned as well, and they said this was a single noise at any specific part of the motion. And they were specifically talking about the knee. And with clicking, a lot of times it means a meniscus problem. And you notice that they said a single noise at a specific part of the motion. So here you're going to specifically find a very, very specific degree of that range of motion that you're going to hear this sound, because it is due to, like, if it is meniscus damage, you're going to hear it right when that femur and the meniscus collide where it's tore. So you're going to hear it at a very specific point in time or point in the motion.
So point in the motion, which means you could probably reproduce it then.
Yep. You should be able to reproduce it, and you should be able to get a consistent reproduction of wear every time. Right. Yeah. And then there's also clunking, very common with meniscus tears as well, and used to describe them. And we also hear it in regards to like the patella clunking back into space into place when people have poor patella tracking mechanics. And it can kind of track back into the groove that it's supposed to be in of the femur, and some of that can be clunking. They also describe creaking, which they said sounds like a creaky door. So they were very descriptive. And they said it's often in arthritic knees. So that creaking, for me, I would throw it under the category of crepitus. That's what I was describing with the crepitus. Sounds kind of like a creaky, cracky, and often in arthritic knees. Not necessarily damage there, obviously not great, but no acute trauma, no pop of a ligament, thing like that. They also describe cracking and popping. They said specifically cracking and popping, which we got the pop before, so that's funny, spontaneous or during manipulation. So again, they describe the cracking and popping as the buildup and bursting of gas bubbles within the synovial joint, aka tribonucleation. So that cracking, popping when you move, and it'd be one time crack or one time pop. And like they alluded to here, spontaneous. When I sit up and I move my hip for the first time in 2 hours because I've been asleep, and I hear that crack or that pop, that is that tribonucleation or that spontaneous pop there. And they also describe snapping, which is the category that I spoke about earlier, so we won't talk about it much, but the snapping hip syndrome. That's some sort of anatomy moving over another anatomy. Tendon snapping over a bony prominence. At the knee, this can commonly be the biceps femoris tendon on the lateral portion of the knee. So again, you can kind of see why it's important to understand like the fundamentals of how we go about thinking about this, because we have so many different areas of the body that we can apply it to. And there's just so much anatomy that it's not worth discussing. Oh, it may be this piece of tissue. It may be this piece of tissue for the sake of this podcast, because it's all over and everything may crack at some point or have a sound to it. And we want to know what that sound means across the board. They also described that fine, gritty, or grating sound. And they said this is found more in asymptomatic and symptomatic people, particularly with OA. I would again, Keoni, describe that fine, gritty, or grating sound as crepitus in my book. And so that's just kind of where we hear these two joint pieces, two joint segments, two parts of the joint interacting with each other and giving feedback due to the integrity of those joint surfaces or something moving along with those joint surfaces.
Yeah, I think you're right. I think
it cartilage.
Right. I think it probably would fall under crepitus, but it is interesting because all crepitus sounds, they don't all sound the same. So.
Right. And I think that's why this Physiopedia broke it down in these multiple ways. And I think that's all well and dandy, but for the average person, painful, not painful, and then a little bit more about it as far as how did it occur, whatnot, and then we have a better idea. And then how old are we? Factor in all these things. What type of joint is it? Like I have a lot more crepitus in my hip that I talked about in that hip health episode, where it's just that weight bearing, that constant compression of that hip creates those arthritic changes. Whereas when I crack my neck all the time, I'm not so worried that that's arthritic. I know I'm moving and I hear that kind of pop or that thud, and then it doesn't happen again when I bend my head to the side immediately after. Right.
And you're not causing problems later on in life by doing that.
As long as you control it, build up that muscular control around it after you improve the motion. And just to touch on that really quick, Keoni, I know we're going to wrap up, but as far as like within a therapy plan of care. So when I'm working with a patient, let's say they're mid-back, they have a lot of neck pain, and I notice their thoracic spine is very stiff, which can cause the neck to be a lot more mobile and have increased demands and give this pain. I mobilize their thoracic spine. The next thing I want to do is make sure I come through and reinforce that motion. So when I don't want to poo-poo a specific profession, but when someone just pops you and then that's it and you leave, how are you going to control that motion, or what's going to stop you from having just to go back to get that pop? So I always follow it up. So let's just say we're doing that thoracic spine mobilization.
Right.
I always, which is typically for more extension, like bending backwards. Yeah. That's how we get tight in the thoracic spine, that and rotation. And with that, I'll pop someone and then have them like use a foam roller to reinforce that motion themselves and come in and out of it to train their whole musculoskeletal neuromuscular system how to move through this new and improved range. And then my hope is that they go and continue to do that in their day-to-day life, continue to maintain that range of motion that we just got through that pop and that relaxation. And that results in further gains of range of motion. And then we address the neck and whatever structure specifically in the neck that we need to address. But that allows us to kind of treat that whole kinetic chain. And then I wanted to kind of make the listener aware that we should follow this up with some sort of exercise to both reinforce the movement that we just gained, like that thoracic spine example, and to make sure, one, reinforce it and keep it, and two, we can control it. So in the long run, we don't set ourselves up for something like crepitus by not being able to adequately control these movements.
And with that specific example, what would be an exercise to do? Is it just like some sort of back extension or?
Yeah. So the back extension, that bending over the foam roller, so that'll kind of reinforce it. And then they're using their muscles to control. They're doing all of that actively, right? And then I've put that foam roller at this segment that we've been mobilizing. So now they're able, it's almost like my hand is there and they're hinging over it. And that allows them to use their muscles to move through it, because I just induced the movement with the pop, right? We talked about that being one of the possible mechanical benefits of this, and psychological benefits of mobilization. And then definitely strengthening the surrounding tissue as a whole. Speaking about thoracic spine, like the rhomboids, the extensors, the middle, lower traps, everything that goes around it. But primarily, if we're talking a specific segment of the spine, it is going to be, front, side, back. How do we stabilize that area? Just in general.
Yeah. And it just makes me think, when back to our sitting podcast that we did, how we sit and we constantly live a life in flexion.
Yeah.
Right. So it's a lot of these exercises out there that seem like people aren't getting benefit, or, don't seem like you're getting much out of them. Like these back extensions, I call them Supermans or Superwomans, where you're on your stomach and you're raising your hands and feet off the ground. And those seem to be super important, since we spend our whole life sitting like we are now.
Yeah, absolutely. I've been releasing a bunch of exercise demos on my YouTube, Keoni, and a few of them, I'm in like a Superman position. I talk about it specifically, just how great it is to do. And I show it in a couple of shoulder drills that are on there. And I talk about, you can see me in the Superman position, but you don't have to be in the Superman position. But I do the Superman position because it's so great to get those extensors firing as much as possible throughout the day, because we are in such a flex society like you're talking about. Right. So trying to incorporate as much of that extension work in general to the average human today is a great idea. And that Superman is a great exercise if, like, you were that thoracic spine mobilization. You just went to the chiropractor, got your back popped. That would be a great one to do.
Yeah, it's funny. They look easy when you look at them, but they're not that easy. I mean, if I try to do them every time I do an ab workout, at least do a series of those to do the extensors, and they're quite hard. It's quite hard to hold in that position too.
Absolutely. Don't forget to suck your belly button in and up and activate your multifidus while you do it. Get all the good benefits.
That's right.
So that's really it, Keoni. I don't know if there's anything else, but again, the whole point was just, hey, the joints make noise. What does that noise mean? And do I need to go see someone? And the answer to that is, if it's painful, yes. If it's not painful, you may be okay being a little bit more conservative with your approach to it. And then if it's not painful, we talked about a variety of different reasons that sound may be there. And you can, through our description of them, kind of figure out what the instance was that led to your sound, and see if you need to go see a physical therapist or some sort of specialist to figure out more about what's going on there.
Yeah, it's great. I mean, one question for me is, would you hear more of this, like the cavitations, tribonucleation, with somebody who's hypermobile, or is there any correlation there or not?
That's a great question. I don't know if, so in someone who's hypermobile, in theory, I would like to say you would probably hear tribonucleation a little less, just because you're not getting that change of pressure as much, because you're more mobile, right? Versus someone who's hypomobile.
And you have more of so you're not getting a change of pressure. You have more of a joint space to work.
Yeah, you have more joint laxity. So that joint cavity, or it's been a work day. Here we are, 6. That joint capsule is not being as stretched and creating that pressure zone that is happening in tribonucleation. Okay. So it's likely that if you're hypermobile, it's happening a little less in that tribonucleation capacity.
Okay, very good. All right. So
people
don't need to stress out about cracking their knuckles so much anymore.
Yeah, just follow it up by strengthening your fingers.
Yeah, Yeah, exactly.
All right, everybody.
All right. That's awesome. Thanks, everybody.